Transcranial direct current stimulation is a non-invasive brain stimulating technique in which electrodes are placed on the scalp to administer a mild electrical current to the brain. The aim of this technique is to induce changes in cortical excitability by producing a low-intensity electrical field. This technique requires the placement of a positively charged electrode, the anode, and a negatively charged electrode, the cathode, over different regions of the brain. The electrical current enters the brain through the anode, travels through the tissue, and exits via the cathode, modifying cortical excitability and leading to small changes in the membrane potential. Changes in the membrane potential occur through a process of polarization. Brain tissue exposed to the electrical field is polarized, modifying neuronal excitability through either a depolarization or hyperpolarization of the resting membrane potential. The efficacy of tDCS to induce modifications of membrane polarity depends on the electrode placement, the strength of the current applied, and the size of the electrodes. The efficacy of tDCS has been demonstrated on many psychiatric disorders with minimal side effects, including for the treatment of schizophrenia. Schizophrenia is a psychiatric disorder with a chronic and debilitating course throughout the lifespan, with many patients unresponsive to medication. Symptoms are grouped into three categories: positive symptoms, negative symptoms, and cognitive dysfunctions. The disorder has been associated with reduced patterns of resting cerebral blood flow to the prefrontal cortex, known as hypofrontality, and impairments to functional connectivity between the dorsolateral prefrontal cortex and task-relevant brain regions. Auditory hallucinations, defined as speech in the absence of external stimuli, are a common symptom among patients with schizophrenia. The treatment of auditory hallucinations with tDCS has shown promising results. Auditory hallucinations have been associated with abnormal activity in the frontal and temporoparietal regions and impairments to self-recognition and source monitoring processes. The most commonly applied electrode montage for the treatment of schizophrenia is the anode positioned over the left dorsolateral prefrontal cortex and the cathode positioned over the left temporoparietal junction. Although the majority of research into the efficacy of tDCS for treating schizophrenia has been limited to case studies, 3 randomly controlled trials employing the commonly used electrode montage have shown promising results, reducing the frequency and severity of auditory hallucinations. Further investigation into the optimal electrode montage is necessary because electrode placement plays a key role directing the electrical current toward the relevant dysfunctional brain regions. A randomly controlled trial by Palmer and colleagues used a variation of the commonly employed electrode montage and demonstrated promising results in the reduction of negative symptoms. This highlights the need to investigate further the positioning of the electrodes and their effect on cortical stimulation. Further investigation is needed into the frequency of the treatment and the effect of higher cumulative doses, as one study reviewed demonstrated no significant effect, reducing auditory hallucinations with once-daily treatments. This suggests that more frequent tDCS treatment is necessary to have a significant effect on the reduction of schizophrenic symptoms. Although reports on the efficacy of tDCS treating schizophrenia are promising, further investigation with more randomly controlled trials and larger samples are required.